This is Africa News Tonight on the Voice of America.
Hello and welcome. Welcome to VOA Africa. Thank you for joining us. I'm Yehiyas Wuhib in Washington. Here's what's coming up on Africa News Tonight.
The lack of vaccines in the region with high levels of poverty and inequality means many people feel they are just waiting to die.
That's Robert Shivambu, spokesman for Amnesty International in Southern Africa, on the need for more vaccines and a faster pace of inoculations in Southern Africa. Details coming up. Also, communities in Madagascar are on the verge of starvation. And thousands of refugees are fleeing into Uganda to escape fighting in the DRC. These stories and more ahead on Africa News Tonight. We start with our top story. The UN Children's Fund says COVID-19 is having devastating consequences on millions of children in sub-Saharan Africa, many of whom become orphaned, making them vulnerable to many social ills. Lisa Schlein reports from Geneva.
Sub-Saharan Africa is in the throes of a full-blown third wave of COVID-19. Children are usually not directly affected by the deadly disease, but they are losing their parents to the pandemic. Traditionally, when children become orphaned, the burden of looking after them falls on the grandparents. However, a spokesman for the UN Children's Fund, James Elder, says older people are among the main victims of COVID-19. Consequently, he says children are shoveled off to another relative who likely is living in dire, impoverished circumstances. The added strain and stress, he says, puts children at risk of abuse and child labor.
We've seen the reporting of children reporting on helplines, violence against them and the need for support. Those things come again when children have lost a support mechanism that they previously had, which often comes from being orphaned or an economic situation where a parent has simply had to leave to go elsewhere because the economic opportunities have dried up due to the pandemic.
Children who do not go to school are unprotected and open to exploitation. Elders says COVID-19 has dealt a devastating blow to education. For example, he notes an estimated 9 million children in Eastern and Southern Africa have not returned to school since they started reopening. He says many children are not getting enough to eat because of growing poverty due to pandemic-related lockdowns. He adds poor nutrition leads to worsening health.
We know that routine immunisation rates and things like malaria access have been slashed, as I say, some by up to 20%. We know that pregnant women have a great deal more difficulty getting to antenatal services. We know pregnant women have died because of that, because of things like lockdown and because healthcare systems are absolutely stretched. Yes, there have been unnecessary deaths of children.
UNICEF says governments must prioritize keeping schools open and safe and is urging them to keep children in school while supplying water and sanitation to schools across the continent. The UN Children's Agency says it is increasing cash transfers to the most vulnerable and providing psychological support for children and their families. It says it also is working to prevent family separation and to strengthen family and community-based care during this challenging time. Lisa Schlein for VOA News, Geneva.
Back-to-back droughts in Madagascar are pushing communities right to the edge of starvation. According to a Reuters report, women and children are walking for hours to reach food after the worst drought in 4 decades devastated the south of the island. World Food Program Executive Director David Beasley says acute malnutrition has almost doubled over the last 4 months, and $78.6 million is needed to fight the crisis. Amnesty International and 27 groups in Southern Africa are calling for a faster pace of vaccinations as a new wave of coronavirus infections sweeps through the region. Zimbabwe is experiencing a shortage of vaccine doses amid a 127% rise in new cases. Columbus Mavunga reports from Harare.
The non-governmental organization said most countries in Southern Africa were experiencing a third wave of COVID-19 and needed vaccines to contain the situation. Here is Robert Chivambu, spokesman for Amnesty International in Southern Africa, speaking via a messaging app from Johannesburg.
A number of countries across Southern Africa, including Namibia, South Africa, Zambia and Zimbabwe, are currently in the midst of what could be the deadliest wave yet. The lack of vaccines in the region with high levels of poverty and inequality means many people feel they are just waiting to die. SADC and the international community must work together to accelerate the vaccine rollout and ensure as many people as possible are given these life-saving jabs. The international community must help SADC leaders scale up vaccine rollout to their populations. Any further delay will have catastrophic consequences.
He said regional bloc SADC and the international community must work together to accelerate the vaccine rollout and ensure that as many people as possible are given life-saving jabs. On Thursday, Dr. Matshidiso Moeti, the head of the World Health Organization in Africa, asked wealthier countries to start donating vaccine doses to the continent. She said richer countries have vaccinated 60% of their populations, while most African countries are at about 1%. She said for Africa to reach 30% by the end of the year, it needs at least 700 million doses.
African people have been vaccinated with the first dose of a vaccine that really needs a second dose in order to work optimally. And these supplies are proving to be a huge struggle. So the urgency of having the vaccines available right now is huge. So in short, the donations are appreciated. The volumes need to be very significant, and it's super urgent that these start to be made available now.
Zimbabwe is one of the countries that have been most affected by vaccine shortages as well as a spike in COVID-19 cases. Calling it an invisible enemy, Vice President Constantino Chiwenga vowed Thursday that Zimbabwe will overcome the third wave of COVID-19. Chiwenga, a former army general, said every Zimbabwean must cooperate for the country to win the COVID-19 war.
By end of this month and maybe into the first week of July, we would have received 2.5 million doses of the two vaccines which we are using, Sinopharm and Sinovac. And we want everyone to be vaccinated, starting with all our borders. And then we'll go into all the hotspots which have been affected. Let me ask the cooperation of everyone. Those who want to trade, you must trade at those marketplaces but have a certificate of COVID-19. So if one wants to sell it at a marketplace, the individual must also get vaccinated. Is that not fair? That's fair, I suppose.
It was not immediately clear if Zimbabwe had moved to compulsory vaccination, as Chiwenga, who doubles as Zimbabwe's health minister, did not field questions. So far, about 716,000 Zimbabweans have received their first shots, and slightly more than 450,000 have received their second. Zimbabwe has 43,480 confirmed coronavirus infections and 1,692 deaths, according to the Johns Hopkins University, which tracks the global outbreak. Columbus Mavunga for VOA News, Harare, Zimbabwe.
A third wave of COVID-19 has filled hospitals with sick and dying patients in Johannesburg, South Africa's biggest city. But municipal officials are refusing to reopen one of its major public health facilities because it does not yet have the certificates to show it complies with city bylaws. A fire gutted only a small section of the hospital more than 2 months ago, but city authorities shut it entirely, condemning it as hazardous. Darren Taylor reports.
Staff and patients of Charlotte Maxeke Hospital have been waiting for the city to do the repairs to get it running again. The mayor's office says the police have to investigate the blaze first, but the police aren't turning up. The police service says its fire experts aren't available.
I think the problem is that it's ended up with an authority that doesn't have insight into the actual disaster that is going on.
Professor Dania Ballot is clinical head of 4 of Johannesburg's largest public hospitals, including Charlotte Maxeke.
And it's a disaster that's difficult to quantify because people don't all congregate in one group and show how sick they are or how many are dying.
She told VOA of a number of deaths she ascribes to the hospital being bolted shut.
One of the little babies arrived dead in casualty at one of the other hospitals because the parents didn't know where to go because Charlotte was closed, so there was delay, and by the time they got the child there, it was too late.
The pediatrician says the hospital cares for many patients with long-term chronic conditions that need constant treatment and monitoring. Without proper help or their medicines, they die, Ballot says.
We serve more than 1,000 inpatients and they have literally 1 million outpatients a year. So not only is it like 1,000 hospital beds, it's almost 100 ICU beds, meaning ventilator beds, about 300 COVID beds and 28 operating theatres. To take that resource out of the system has just overburdened the other hospitals.
City officials say patients who usually go to Charlotte Maxeke should now go to other hospitals. But as Ballot points out, these are already full.
Patients are lying on the floor, patients are lying in stretchers in between hospital beds. At Chris Hani Barra, they're having to close the surgical wards to accommodate the extra patients from the COVID wave.
She says doctors and nurses are collapsing under the strain.
Clinicians are at the end of their tether, really. It's extremely, extremely stressful. It's exhausting, and they are overburdened, and they really don't know where to turn because it just seems that all their pleas for assistance fall on deaf ears.
Those ears are insisting that forms are filled in, boxes ticked, dotted lines signed.
Unfortunately, I think we've now got tied up in some sort of bureaucratic process of trying to get plans for the hospital drawn and trying to get fire hydrant couplings on certain things, which I'm not saying are not important, but I think one has to balance that up against the impact on people's health and literally lives.
Ballot says she welcomes a promise by the municipality that it'll allow Charlotte Maxeke's cancer wards to open on Monday. But she adds it's just not enough. For VOA News, I'm Darren Taylor in Johannesburg.
Uganda's reinstatement of a coronavirus lockdown through the end of July is squeezing the ability of many people to earn a living. Street market traders are forced to bicycle, walk long distances, or just sleep in the market. Halima Atumani reports from the capital, Kampala.
With coronavirus infections soaring and hospitals overwhelmed, Uganda has reimposed a lockdown on transportation through the end of July. Buses have been shut down, driving requires a permit, and only essential workers are allowed into Kampala. While the aim is to save lives, making a living is once again a struggle for traders like Sauda Namaga, one of many forced to sleep in the market. She wants Ugandan President Yoweri Museveni to ease the restrictions. We are selling rotten produce. All the bananas, as you can see, we don't have buyers. So we are asking the president, and those who talk to him should tell him to relax the orders. Those who are able to walk to town should be allowed to come and buy. The situation is even worse for shops not selling food, which Ugandan authorities ordered closed. Ugandan police are being deployed to enforce the commands. Area Chairman Bashir Mwonge says without help, many shops won't survive. If you keep imposing a lockdown, what do you think is going to happen? This means the country's economy is falling because there is no work being done. We have been appealing to the president to help by suspending rent payments. The economy is crashing because people can no longer maintain their businesses, even when you reopen. Ugandans living in the countryside are forced to walk for hours to get to town. Lydia Nambogo walked more than 5 kilometers to withdraw money from her savings to feed her family, but the bank office was closed. I've been selling takeaway food and have been earning little money to take care of my family. But we've been locked down and we don't know what's coming next. The government isn't going to give us food again. They should at least give us some of our little savings. With Uganda's first lockdown in March 2020, the government gave flour and beans to the urban poor, which many hope will be repeated. Ugandan Prime Minister Robin Anabanja says they are going to identify the vulnerable.
We are going to use some simple means of delivering support to you. And the vulnerable people are known.
Meanwhile, many Ugandans can only wait for this latest wave of COVID-19 infections to recede while doing their best to keep their heads above water. Halima Athmani for VOA News, Kampala, Uganda.
Malawi's government Tuesday announced a goal to eliminate malaria, a leading cause of death in the country, by 2030. The mosquito-spread parasitic disease accounts for about 15% of Malawi's hospital admissions. Lamek Masina reports from Blantyre.
Speaking during a televised launch of a nationwide anti-malaria initiative known as Zero Malaria Starts With Me campaign, President Chakwera said statistics on malaria infection in the country are worrying. He said malaria contributed about 36% of all outpatient department cases and 15% of all hospital admissions in Malawi.
This creates a lot of work for our health workers and pressure on drugs in our public health facilities. And additionally, malaria remains the leading cause of death in Malawi, claiming 6 lives every day.
President Chakwera said last year, Malawi registered 6.9 million malaria cases, more than a third of the total population, and lost 2,500 lives because of the disease. It killed more Malawians than any other disease, including COVID-19. The Malawi leader said his administration is committed to do whatever it takes to create a malaria-free country.
And admittedly, this commitment cannot be government alone. Malaria is a collective problem that demands a collective strategy. By collective strategy, I'm referring to the private sector players and development partners who need to put money where their mouth is and join their resources to ours so we finance this fight together.
Chakwera announced what he called 10 commandments, which would help in preventing and cure the disease. These include clearing all breeding grounds for mosquitoes, timely taking of prescribed malaria medication, and sleeping under a mosquito net.
My administration will distribute 9,258,645 mosquito nets in 25 districts and do indoor residual spraying in the districts of Nkarabe, Korakota, Balaka, and Mangochi. Currently, only 55% of Malawians sleep under mosquito nets, and we need to get to 100% to prevail.
The initiative is part of the global campaign to end malaria by 2030. The U.S. President's Malaria Initiative, launched in 2005, is among the financiers of the campaign. The program's team leader in Malawi, Monica Batista, explained how malaria personally affected her.
When I first started working on malaria, it was not a personal issue for me. That all changed just 6 months ago when I lost a dear friend to malaria. Now the fight against malaria is personal for me. I understand what it feels like to lose a loved one to this preventable disease.
She said U.S. government has for the past 15 years contributed about $270 million towards malaria prevention and control activities in Malawi.
The strides we've made against malaria, though significant, are delicate and incomplete. To defeat malaria, we will need a more concerted effort among the private sector, the public sector, and civil society together as a whole.
She said the launch of Zero Malaria Starts With Me campaign serves as a call to action. Lamek Masina for VOA News, Blantyre, Malawi.
More than 10,000 refugees have fled into Uganda to escape fighting in the Democratic Republic of Congo, raising concerns that they might worsen a deadly second wave of COVID-19. Catherine Nambi reports.
For weeks, refugees have been streaming into Uganda from the DRC's Boga town, about 25 kilometers from the border. Although Uganda closed its borders to refugees to stem the spread of COVID-19, authorities say it's Uganda's obligation to provide shelter to all people fleeing instability in their home countries. Misachi Kawamala is the Ntoroko resident district commissioner.
Our border here is very porous. It's very difficult to manage, especially stopping people who are running away from war. It is not advisable to stop people running away from war. A war situation and stop them from entering. You will be sentencing them to death. So we are advised not to stop them, and we have not stopped any of them. Even on some borders which are manned, our people have to run because they are running away from death.
But officials say that due to constraints on resources needed to take care of refugees, most have ended up mingling with the community. Ben Mosoke is the Ntoroko District Police Commander.
Unfortunately, because of lack of the support, they are vulnerable and they have been dispersing to different communities. The first group came up to our town council. They are in somebody's community, in somebody's home, in fact, because they have relatives. And you know, we are at the border, and Ntoroko is at the border. You find one family in Budiva is having relatives in Congo. In the evening, they are this side, and in the morning, they are in Congo. So we have that challenge.
Kawamala says residents and authorities are concerned about a possible spike in COVID-19 cases.
And we are worried, and we have a lot of fear because these people could have come with infectious diseases. Because you know, Congo, the health system there is very poor. Not only the Congolese, but even our people here are infected. So they have mixed up with our people. They have gone to their homes. They have rented some small houses in some trading centers, mixing up with our people in the markets, in health centers. So we are really worried that it is.
The Office of the Prime Minister, the UN Refugee Agency and security agencies are screening the refugees ahead of their transfer to a transit center. This is Catherine Nambi for VOA News in Kampala.
And that wraps up this edition of Africa News Tonight. I'm Yehis Wuhib in Washington. For all the latest developments on the continent 24/7, visit our website at voanews.com. On behalf of our producer, Mokbil Iyabaro, thank you again for tuning in and choosing the Voice of America.
Hello, I'm Carol Castiel, host of Press Conference USA, VOA's newsmaker interview program. Join us each Saturday and Sunday when we talk with authors, analysts, and policymakers who provide fresh insight on topics ranging from U.S. politics and foreign policy to science, culture, and global health. You can listen to Press Conference USA on the radio or online at voanews.com/PCUSA. While you're visiting our website, be sure to subscribe to our podcast. We'd also love to hear from you. Just send an email to pcusa@voanews.com or connect with us on Facebook at facebook.com/Carol Castiel VOA or on Twitter at Carol Castiel VOA. That's Press Conference USA every Saturday and Sunday on the Voice of America.
VOA brings you the best in African music on the African Beat. African Beat showcases the latest and the greatest of contemporary African music, from Bobo music to hip life, bongo flavor to soukous, Afrobeat and Ndombolo and Makossa to Kwaito. The African Beat on VOA has it all. And it's happening right here, Mondays through Fridays at 09:05 and 20:05 UTC, right after the